we have all three situations. We have COVID-19, we have the worst recession since the Great Depression, and we have a looming Cold War with China. So it's not surprising for us as Asian American scholars to see this upsurge in racism. But we knew we also needed to document it, not for Asian American studies, but to develop policy interventions to hold government and corporations accountable for what's happening to Asian Americans. So we created Stop AAPI Hate because our government didn't create a reporting center to collect this type of information. We asked, and immediately we were flooded with self-reports of the racism they're experiencing. And just to give you a quick data point, a good study by UCLA found that 5.4% of Asian Americans have experienced racism during COVID-19. That doesn't sound like that much, but in California, Asians make up such a large percentage of the population. 5.4% of Asian Americans amounts to over 270,000 cases of anti-Asian hate since COVID-19. That's over 1,000 incidents a day. So we've only received maybe a tip of that iceberg, and I'm going to share with you what some of the accounts that we've been receiving and invite Christine or Alexis and Derek to read them off.
I was waiting to pick up food from a restaurant, and a group of people walked down the street, started yelling and cursing at me, saying that I'm the one who brought the virus to the US.
My sister was shopping and wearing a mask. When she would look at certain merchandise, an employee would follow her and clean where she had touched. My mom noticed that she did not do this to any of the other customers, all white, only my sister.
My son was on a summer camp field trip. While there, a girl from his camp group told him that all Chinese people have the coronavirus. She said that Asians brought the virus. Then she proceeded to get the other kids to play a game called Corona Touch and said that he had the Corona Touch. The constant insults ended up making him cry. The camp counselor stepped in at that point to stop her.
As soon as we walked in, there were stares from the other families. Some of them hugged their children closer to shield them away from us. I walked past a family that called us Ling Ling, and my brother overheard a woman say, "Stay away from those Chinese people. They have corona."
A white man got in my face and coughed on me twice and told me to go back to my country.
Someone wrote infected on our garage door and that of our neighbor, who is also API.
Elderly grandparents were taking our one-year-old daughter for a walk in her stroller. A group of young men followed them, yelling that they had coronavirus.
My friends and I were live streaming on an app called Yubo. People joined us and asked if we ate bat soup. They also added bat and soup emojis.
A woman targeted me out of a group of people and shoulder pushed me extremely hard where my phone nearly fell out of my hands. She then said to me, "Fuck you, Chang." Afterwards, she spat on a man who defended me and tried to spit on me as well.
I was in line at the pharmacy when a young woman approached me and sprayed Lysol all over me. She was yelling out, "You're the infection. Go home. We don't want you here." I was in shock and cried as I left the building. No one came to my help.
Thanks. So I'd like to actually invite you now to enter the chat and just type in your responses. Feel what other Asian Americans are going through at this moment. And I'd love to hear how you react to these comments. So I see a lot of strong feelings of anger, shame, anguish, empathy because it's experienced. We did a survey of youth, and the highest percent of the most dominant feeling that Asian American young people feel now is anger and disappointment in the betrayal of the American dream as they see the injustices against Asian Americans and also against Black lives. So quickly, thanks for sharing. Let me just give you some of the data so we could give context of what's happening nationwide. Verbal harassment and shunning make up most of the incidents of hate. They're not hate crimes, but they're not microaggressions either. They're virulent, hate-filled tirades where people get yelled at a lot of profanity, a lot of racial slurs slung at people, and oftentimes directed at children and elderly. So a third use anti-Chinese rhetoric in these cases. About 8% constitute civil rights violations of being barred from establishments, workplace mistreatment. And I could talk about that later, that we see at Stop AAPI Hate that this is more of a civil rights issue more than it is a hate crimes issue. And that distinction is going to be important as we think about solutions. Hate crimes, though, do make up 8 to 10% of our incidents. People are being coughed and spat upon so often that we actually created a special coding category for it. And physical assault includes being pushed and shoved, having rocks and bottles thrown at us. The worst case scenario so far is a family of 3 being slashed in the head. There's been other celebrity cases like the woman in New York who was burned, but those aren't necessarily clearly anti-Asian hate. Most people say that race is a reason for this racial violence. 60% are non-Chinese. So if you look East Asian, you're more likely to get harassed. A Latino in LA, an Indigenous person in Vancouver were both told to go back to China and punched. Early on, the mask was a racialized profile, racialized object of scorn. So Asians had to debate, should I wear a mask and risk facing harassment, or should I not wear a mask and risk getting the disease? But that was a sort of a valid sort of risk factoring that they had. And gender was only mentioned 8%, but it's clear this is an intersectional issue. Women get harassed 2.4 times more than men. Among youth, girls get harassed 2.4 times more than boys. And so we're going to do a women's report because people are bullying, and bullies tend to attack whom they think are vulnerable. And it's also, they're using COVID-19 as an excuse to harass Asian women. And finally, just to summarize, because we're sheltered in place, most of the incidents occur in business sites where Asians do interact with people, a lot of public spaces, and early on, a lot on public transit and in schools. So given this type of information, we've been trying to develop policies addressing how can we improve public transit safety? How can we make school bullying reporting more accessible? So that's what's going on nationwide. This is a pervasive, widespread experience. Asian Americans fear racial bias more than ever. We've gone from crazy rich Asians to crazy infected Asians. I think our community is hypersensitive and aware of this issue. And I'll stop there for the other panelists.
Great, thank you. Thank you so much, Russell, for that. Vivian, can you share with us your screen? Is that?
Yes.
Oh, no, you're not sharing screen.
Oh, no, I'm not sharing. Yeah.
Tell us about your project.
Yeah, thank you so much for having me. And also, thank you especially to Dr. Jeung. Very early on we spoke, and he generously gave me advice on how to develop this project. And I'll talk a little bit about how I think that this is a really important moment for thinking about collaboration and what our research means kind of beyond some of the traditional kind of definitions of academic research and the impact of that. I think that the link to our website will be shared at some point. But as was mentioned, I am the lead researcher for the AAPI COVID-19 project. Let me just give you a little bit of a background about how this research started. So I actually have researched these issues of racial politics after disasters for, maybe the past 7 years or so. I did that actually in the context of Japan, looking at social movements and anti-racist movements that had grown out of the social and political landscape after the Fukushima nuclear disaster. And so when we started seeing this racist backlash, and I think what's kind of important to say is that I tend to avoid saying that there is an increase in racism, because I don't know if you can necessarily make that type of qualification. Rather, racism is becoming more apparent and visible, right? And so I think that so I'm not necessarily using these types of quantifiable terms, but as we started kind of seeing anti-Asian racism becoming more visible, and that in relation to this ongoing disaster, I started talking to colleagues, and some of them kind of advised that this is kind of a way to think about racial politics as well. So I started off on Twitter and asking people about what types of stories, what types of experiences I had, and really was trying to just get a lay of the land and just kind of try to understand what was happening. And what became very apparent very quickly was that the scope of experiences that people were having, encompassed a diversity of different types of incidents, affected them in many different types of spaces. And so I wanted to kind of find a way to understand racism across many different types of categories of experience. And so I'll just kind of give you an example. One of the early stories that came out was, for instance, a man talking about, going on a gay dating website and being called coronavirus on there. Another story I heard was a mother in the Midwest who lives in a town that is predominantly white and very few, Chinese families in there. And she was worried about her kids experiencing harassment, and her young children, and, becoming very upset about that. And so we started from there, and I kind of, I had actually, after posting about this on Twitter, one of a graduate student at UT Austin, which is where I did my graduate school degree, reached out to me and asked about, potentially collaborating. And so I kind of thought at that point, this is a really good kind of opportunity for us to think about how do we kind of come together and pool our resources and create a team. And so we ended up creating a team, and now we have like about 11 people, some core researchers, and it's a mix of all junior scholars. So we have, Jason Beckfield is also kind of the co-lead for this, but overall we're primarily, we're assistant professors, postdocs, graduate students. And what we came up with, trying to think about how we had a lot of people, we wanted to look at multiple areas of life, right? Because when we want to think about these civil rights violations, we kind of wanted to go beyond the incident and the event in which somebody is having this very acute experience of anti-Asian racism, to think about how racism kind of pervades into multiple aspects of life, right? So what we came up with were 6 different areas: labor and the economy, community organizing and advocacy, health, education, family and caregiving, and social media and online spaces. And we wanted to look at this through mixed methods. Again, a lot of this was organic, based on, say I brought on Dr. Cynthia Wang, and then she had a colleague who's very, skilled at quantitative analysis. So this is kind of how we kind of put together a team and thought about what our capacity for doing research was. And what we ended up doing was, because, rather than creating 6 different studies, which is a lot, we thought about what are some of the key research questions and how do we kind of frame some of these different issues. And what we kind of realized early on was that when you think about something like labor versus health versus family, they are kind of 6 different ways to categorize experience, but they're not necessarily distinct, right? They are overlapping. I think you can make a similar sort of comparison to when we think about intersectionality and race, gender, class overlapping. I think also similarly, it can be difficult to parse out labor, health as different types of things, because they all they shape each other. And of course, those are class issues, those are gender issues and things like that. And so right now we have 2 active studies, and kind of the way that we have framed this larger investigation is thinking about the effect of the pandemic on Asian Americans, Pacific Islanders, and Asian immigrants at work and at home. And so some of the issues that we were looking at are how is it that Asian AAPI, when they're doing work, are negotiating a lot of these different risks that they have to contend with. I'll kind of provide a little bit of specificity to what I mean by that in a second. How are they kind of negotiating different types of risks? And when we think about risks, they're not only health, right? They're not only financial. They're not only dealing with racism. It's all three, right? Maybe more than three, but dealing with compounded issues. And then similarly, we're thinking about home environments, right? And so, for instance, when you look at some of the data about intimate partner violence, family violence, mental health, economic instability, and racism are all each independently risk factors, right? So we're looking at what happens when you bring them together, right? And we already know that there's a lot of data about disasters, how these types of family instabilities are often, brought to a boiling point. And so this is kind of how we are looking at some of these questions. So I realize that I'm running low on time, so I'm just going to very briefly provide one example. One of the examples that we're coming up with and that we're trying to think about is how a lot of the conditions prior to the pandemic have exacerbated what people are experiencing now. And so for one of them, for instance, an Asian OBG nurse midwife, she kind of is talking about how certain rules around, say, like, the global gag rule in terms of informing people about patients about abortions, this kind of created a situation in which her clinic, which serves Asian undocumented immigrants, was much more financially vulnerable. And they ended up having to being in a much worse position during the pandemic because of these kind of pre-existing political conditions. And so I'll leave it there, but just, to think about how a lot of what we're seeing now has the foundation for that was laid before the pandemic. And so that's kind of what we're thinking about now. Thank you.
Great, thank you for that, Vivian. That was really informative, and the project sounds wonderful. I'm hoping we get to hear more about it through the questions and answers period. But next we'll move to Juhwan Seo. Juhwan.
Hi, everyone. So I'm going to be talking a little bit more about labor and employment in Asian America. And Dr. Shaw already kind of set this up really perfectly for me, so I'm not going to go too much into detail. And this next slide is kind of like sociology one-on-one, so I'm not going to do all the details. But basically, I want to kind of expand the domains of the racism that we're considering today. And I suggest that we consider different levels of the larger system that perpetuate anti-Asian racism and white supremacy more broadly. And so I guess you might wonder why this is helpful to understanding racism and inequality in the age of COVID. And I guess I think of crises as exacerbating existing inequalities, like Dr. Shaw just talked about. And so existing axes by which our communities are stratified are being widened. And so it's critical that we contextualize the hate and discrimination that have been illuminated to us during the past few months as part and parcel of a larger structure and processes of racism and white supremacy. And so like there are obviously a lot of historical literature on this, but I want to kind of talk a little bit about how we can link micro, meso, and macro processes by looking at, for me, labor and employment as an example and case study. So I think a lot of the stories that we heard in the media and that the previous panelists have shared are really powerful and kind of helping us understand what kind of experiences a lot of Asian Americans are having. But I also suggest that merely measuring perceived discrimination is not enough for a variety of reasons. So one is that perceptions of discrimination is actually more highly reported among people of color with more education or higher income. And so I want to focus, and emphasize that it's the most vulnerable members of our community who don't have access to these resources or don't perceive their experiences as necessarily being discriminatory or hatred. Similarly, data on Asian Americans is really fraught always. And so because of the great ethnic diversity that we have, it also means that it's really hard to capture enough data for enough group. And so it's almost never representative. And I know we can always talk about that as sociologists and social scientists. But again, it's the most underserved and most vulnerable who are left out of these measures. So I'll be adding two layers to the picture of anti-Asian hate in my work. One is the economic inequality. So in the hourglass economy that we live in the age of late capitalism, it means that there's increasing economic inequality in our society, both between communities like Black-white gaps and within a community like Asian Americans. And this is particularly significant among Asian Americans, as you can see on these graphs, that within race, income gaps are the biggest among Asian Americans of all racial groups in the United States, and it's only growing. And it's not just income, but also rates of poverty, education level, language proficiency, healthcare, and many other measures of well-being and material well-being. And there are strong patterns along these lines of inequality in terms of ethnicity. So it's particularly Southeast Asian American ethnic groups, particularly Hmong and Cambodian Americans, who are the most disadvantaged. In the age of COVID, unemployment has been really heightened. And so Asian Americans have been really hard hit by the pandemic, much more so than before during the recession, the Great Recession previously. And so as you can see here, this was recently reported in NPR that the rates for Asian Americans are much higher than one would expect and one would hear about in media and have been historically. We also find that the unemployment rate is even higher than previously reported, and we might think just because, again, with data with Asian Americans is quite difficult. And so official data systematically undercount many communities like Asian Americans, women, and immigrants, according to the Pew Research Center. And so there are reasons why this is happening. One, in part because the occupations and industries where a lot of Asian immigrants are working are the ones that have been the hardest hit. And obviously there are other factors like geography of where Asian Americans live, especially with the pandemic, has been really hard hit, and also limited networks. So a lot of Asian immigrants rely on co-ethnic networks in order to find work and other opportunities. And those, though can be protective, also can be limiting, especially in times of crises. And so I guess the takeaway here in adding the economic layer is that many members of our community live in great precarity and are especially vulnerable in this time of crisis. And so the next layer that I want to add is immigration. And so among Asian Americans, there's a large body of Asian Americans who are undocumented or live with precarious immigration statuses. And so I suggest that undocumented members of our community are the most vulnerable, and I look at this in the context of work. And so previously I've organized with the Tompkins County Immigrant Rights Coalition here in Ithaca in providing immigrant rights and knowledge for undocumented workers, especially in Asian restaurants. Now I am embarking on my new project where I look at how Korean restaurant owners in the New York City area hire and manage low-wage immigrant workers. And I'm actually interested in obviously how co-ethnic workers have been treated and potentially exploited, but also how Korean immigrant owners, business owners hire Latinx workers and treat them potentially differently than Korean workers. It's important to note that most of these workers are undocumented and face vulnerability at many different levels for economic reasons, at immigration status, and with the legal system, healthcare. And so all of these systems, like I showed earlier, are kind of interlaced and add on top of each other in making immigrant workers the most vulnerable in many ways. They're also rarely eligible for social or welfare services, especially during this time of the Trump administration, where public charge rulings have really scared immigrant communities from accessing resources to which they have legal access. So I kind of close on that note to kind of provide context to where I'm coming from. I'm in the process of gathering data, so I hesitate to really share a lot about what I think is happening, but I think the kind of broader picture with statistics show that there is likely to be significant negative impact on the well-being of Asian immigrants broadly, but especially low-wage workers. Thank you.
Thank you, Juhwan, for that, and for sharing even the preliminary results of your research there. That's really informative. So before we get to questions from some of the audience members, I was hoping to just sort of ask maybe one or two rounds of questions. We'll see what the time looks like. I want to make sure that the audience members do get a chance to pose their questions or comments. But I was wondering, each of you mentioned in a slightly different way right? A broader kind of context. Vivian's interested in sort of post-disaster responses. Russell had mentioned sort of the confluence of a pandemic, of the Great Recession, and sort of geopolitics, right? This Cold War with China. Juhwan mentioned sort of under the current administration, a particular kind of immigration politics. So I was wondering if I could ask you, each of you, to sort of talk a little bit about quite beyond, the epidemiological or the medical aspects of the pandemic, how the sort of current political and or geopolitical environment really, how you see that playing out in your research and in the findings that you've identified. To talk a little bit about sort of, where the U.S. is politically in 2020 and how that affects the response of toward Asian Americans and Pacific Islanders in the midst of this pandemic. So Russell, do you want to start us off?
Sure. I'm going to share slides again because it's easier for me to, or maybe, well, quickly, the great comparison cases too after 9/11, where Muslim South Asians were met with interpersonal violence and racist policies, detention, deportation, registration. And then you compare that to today from the pandemic, and there's two clear differences in the space of racism. One is the presidential response. President Bush back then said we shouldn't attack our Muslim American communities, whereas President Trump insisted on using the term Chinese virus. And that insistence basically racialized the virus, that the virus is Chinese and Chinese people have the virus. And so that was really significant, and it was clear there's a correlation between his insistence on using those terms, it being retweeted. That type of hate speech then gave license to racial hate. The second difference between 9/11 and now is social media. And we didn't have the internet back then. It was sort of hard to think about before we had the internet. But social media really circulated pictures of Asians or Chinese people eating bats, circulated pictures of Asian people wearing masks in the face of the pandemic. So I think that chemically hardwired in people's brains, again, that association that the coronavirus is Asian and Asians have the coronavirus. So when you're looking for comparisons and factors that have led to the racism, I would argue that in the contemporary situation, the political rhetoric has really driven up hate incidents, and then social media has that sort of cementing impact. And so those are really good topics for students to study and to investigate. And actually also good policy ways, how do we address it? If those are the roots of the problem, how do we get to the roots of racism?
Vivian, do you want to chime in?
Yeah, sure. So I'll just say first that when I first was thinking about this question, I was thinking about kind of political in like a much longer kind of durée. And so some of the things that struck me were how, and I had kind of alluded to this with talking about, Trump's global gag rule on abortion, which, is now kind of affecting the financial health of this particular community clinic. But also just kind of more like the kind of the longer duration of some of these political issues that maybe are not things that we can put a finger on in terms of the past like 10 years or so, but are much longer and kind of much more woven to this fabric of what, the US, how it has been structured as a state. But there are a couple of things that I can think about. So like first, for instance, there's one story that, comes to mind in terms of thinking about how the US is set up now in terms of refusing to develop a robust social safety net, right? And how that kind of is shaping the different types of experiences that AAPI, but also not only AAPI, are kind of making certain types of decisions around, what they do with their lives, how they kind of expose themselves, and how that is kind of really affecting people, right? So I think that is part of the story. The example that I want to share is a really interesting conversation I had with a young, like a 23-year-old. So he also went to like a really good school, just like Cornell, and is working at a really excellent medical research center that is well resourced. But even despite being well resourced, they still had to resort to, stopgap measures to deal with this pandemic. And so what they ended up doing was they had to, because they didn't have their ventilator set up to their central systems as much, they had to start recruiting entry-level employees to actually, take the role of monitoring these ventilators, right? And so he had been working as a research assistant in this hospital, and then was asked, right, to kind of switch over to this role of being in ICU and monitoring these ventilators, right? And he said that he was asked, but he uses the word voluntold because he was told pretty explicitly, you can say no, but if you do, there may be some risk, right? So he said yes, and he had only been at this job for a couple of months. After he had said yes, he called his parents who, live in New York and work in, a jewelry store, and also his girlfriend. And they said, well, I guess, you need this job, so you can't say no, right? And so one of the arguments that one of the ideas that we're thinking about is how the lack of a social safety net, the lack of, how healthcare is not universalized in this country, how that is kind of actually factoring into some of the decisions that people we're speaking to are having to make that affect how they are kind of negotiating these questions of risk, right? We can think about how negotiating risk is not a zero, there's no like 100% kind of way of preventing yourself from being exposed to risk. But even beyond that, the conditions by which people are negotiating risk is kind of very much shaped by these broader structural conditions, right? And so we see in this case how the US's decision to not invest in a social safety net is directly leading to people making decisions in which they may not be totally comfortable with having to expose themselves in certain ways, but they feel compelled to because they don't really have other options, right? So that's kind of how I'm thinking about the political impacts and the landscape that shapes this.
Great, thank you for that. Juhwan.
Yeah, I mean, I already touched on, I think, some of this, so I'm going to speak just really briefly. So like I mentioned, the public charge rulings have been really devastating for the most indigent of our communities. But also there have been a lot of very blatant attacks on immigration that I know some scholars have already coined or framed them as being anti-Asian, even though they're broadly anti-immigrant. So the easiest examples that we've seen most recently are against international students, and there have been many attempts, as a lot of us probably know because we're all at the university, that there are attempts to kind of really limit international students' ability to take class and study in the United States. And there's a new ruling that just recently came out a couple of weeks ago that is also trying to limit the length at during which international students can stay in the United States to stay. And of course, I mean, the ability to continue to live here with other statuses are also increasingly more difficult. So I think even starting from 2017, we've seen additional scrutiny and anti-immigrant policies coming out of the White House. So I think it's hard for me to really say specifically to what, but I feel like almost every day we hear about news that's happening at the national, but also at local levels that are really in terms of immigration policy that are really impacting immigrants, in particular Asian Americans, in all aspects of life.
Thank you, Juhwan. So can I just I'll make a quick note to the audience members. After this round of questions and answers, we'll move to your questions. But I really where Juhwan left us there with that sort of that framework of thinking about AAPI people, not just sort of within a kind of a context of narrowly defined sort of ethnic or racial discrimination, but within a sort of broader framework of anti-immigrant politics and policies. That got me sort of thinking a little bit about the broader political context, especially in regard to race and immigration. And I was wondering if any of you had any sort of preliminary conclusions that you might have drawn, or whether you might want to make any observations about how the particular forms of anti-AAPI hate or discrimination that you are documenting relate to other forms of racism, xenophobia, and as I guess Juhwan points out, a particular form of nativism, right, in state policy. And you know, the age of COVID is also been we've seen the continuation of protests around anti-Black racism and in particular anti-Black state violence. It's also a moment when we have continued protests and you know, debates. I guess there are debates about this, but certainly continued protests and policies about migrant camps and child separations at the nation's southern border, right? All of this is happening at the same time. And I'm wondering whether you see any connections or any things, any sort of factors or elements that are connected. Anybody want to start with that one? Russell, yeah.
Big weighty questions. So to connect the dots, as I said, the status of Asian Americans is really conditional. And in the era of Black Lives Matter, Asian Americans have to ask, am I complicit with white supremacy? Am I in solidarity with Black Lives Matter? Where do I belong in America's racial hierarchy? And we're sort of stuck because we are both complicit and in solidarity, right? And that's because we don't fit in that white-black binary. Instead, Asian Americans are actually better positioned under the outsider-insider binary of racialization. And currently with COVID-19, we're perpetual foreigners told to go back to China. We're outsiders. And so now we're subject to both racism interpersonally and told to go back to China and you effing, you know, on an individual level, but on the policy level, like Juhwan talked about, we're experiencing all these racist policies as outsiders. And so we have the second Chinese Exclusion Act. We have an immigration ban, we have a Muslim ban, we have a curtailment of refugees, we have a curtailment of H-1B visas, we have the banning of WeChat. It's clear, connect the dots, that the current administration is using COVID-19 as an excuse to further his anti-immigrant America is a white Christian nation, and to reinforce those boundaries and to exclude Asians. And so that's what I see happening on an individual level and on the policy level. We're being sort of, again, racialized as the outsider instead of the model minority.
Thank you. Vivian.
Oh, yeah. So again, a really big question. I'll try to kind of, summarize in a nutshell. I think that what I'm finding in some of these interviews, and I'm sure, I think other people are also having this experience, of sometimes, speaking to people and, many people have experienced, direct incidents of racism, but I think a lot of other people may not necessarily have, and they actually are trying to figure out like, well, how do I kind of fit into this current climate, right? I mean, I think that some people, especially people who are like working at home and not necessarily actually going out that much, they aren't necessarily having these direct experiences all the time, right? But I think that a lot of the, both the sort of discussions about anti-Asian racism as well, and in kind of tandem with a lot of these discussions about Black lives and anti-Black racism, I think a lot of people are starting to think about what does it mean to be Asian American or Pacific Islander, and what does that identity mean socially and politically? Where do we go from here? And so I'm going to just make a couple observations that I've noticed that I think, I think we're in a moment of contradiction, right? I don't think that we actually can make a claim about AAPI overall having a particular type of experience or political formation. And it's in some ways up to us to try to think collectively about what types of directions we want to kind of push our communities in, right? Example, very early on, I remember I was looking at Facebook. Someone had told me about a particular group that was kind of looking at anti-Asian racism. And I saw it kind of very early on in these spaces that there was actually a perpetuation of anti-Blackness in a lot of the discussion about this fear of racism, right? So I think that oftentimes when we talk about racism, we can very clearly point to white supremacy, right? But then we can also think about how some of these fears about being attacked, right? those aren't only targeted only towards, white supremacists, but also to many other groups. Some of them are POC, right? And so I think that is a sort of reckoning that is also kind of related to histories that we have, such as the LA uprising, LaTosha Harlins. I think those are part of the picture in terms of how people are trying to reckon with this moment now. I'll be very brief with 2 more points. I think another question we have is, how do we reconcile this, I would say broader recognition, which is kind of, in some ways, there's a lot of consensus about this among, progressive left communities about, knowing that police brutality is wrong, right? And that the carceral system is racist, with also trying to figure out how do you deal with something like hate crimes, right? I think that this is like a question, especially when we think at a policy level about what types of relationships Asian American activists, for instance, are kind of building in terms of, are we working with attorney generals? And I think this question about how do you deal with this kind of systemic problem legally, culturally, socially, I think this is kind of raising this contradiction and a question about can we do this without kind of leaning into the carceral state, right? I think it's very complicated and something my students are kind of thinking about. And then just finally, I think it is also important to kind of unpack, this notion that AAPI is this kind of a solidified community, right? Because we see so many disparities within that. Already kind of some discussions about, from Juhwan about, immigrants from different backgrounds, undocumented immigrants, Southeast Asian immigrants, Hmong, but also I think Pacific Islanders. And what we see is, for instance, with Marshallese, like enormous rates of suffering from COVID. In Northwest Arkansas, this population makes up only 3%, but then they are suffering 50% of COVID deaths, right? That is directly related to histories of colonialism in terms of how migration patterns have been shaped and where people have settled and what types of industries they have ended up in, right? So many of them are essential workers. So I think that we need to think about what are the ethics of looking at these issues. And, I'm in East Asia, I come from a Taiwanese background. What does it mean when we have a sort of research community that is Asian American studies, but is predominantly East Asian, and how, many different communities such as Pacific Islanders have been left out of that, right? And so, I don't have to go into this at great length now, but, we're trying to figure out how do you kind of approach these issues ethically, and what types of transformations can happen through like really considering those types of ethical dimensions.
Great, thank you, Vivian. That's a wonderful answer to a big question. Juhwan, do you have thoughts about this?
I'm going to like go off what Dr. Shaw said. It was really helpful, actually. So I'm also thinking a lot about how the most vulnerable of our communities are becoming, their vulnerabilities are becoming more visible to us. But I think in many ways, I also would like to, as I did in my my remarks, kind of add the class analysis to race. And I think especially in this moment, it's very clear how the concept of racial capitalism is needed and effective in understanding and explaining much of what's happening. And I say that because, like both previous panelists said, what we see in terms of anti-Asian racism and hatred is happening in conjunction with other forms of racism and white supremacy, and they're all linked in many ways. Yes, as a white supremacist project and in a way to oppress all people of color, but I think it is happening in conjunction with, and necessarily in conjunction with, capitalism and class oppression. And so for me, like thinking about why, I think kind of in part answering Shannon Gleason's question, in part is that why do we consider, and I think I have to question this for myself too, why do we have to consider Asian restaurant owners as necessarily the oppressor? And I guess we do have to take a more nuanced position. And if we do that, is it that these small business owners have been put in the position of becoming capitalists and exploiting workers when in fact they could be in solidarity with low wage workers? And I guess that if I extend that to further to thinking about cross-racial solidarity, it's also very much clear, especially in this case with, like Dr. Shaw mentioned, with Pacific Islander communities, but also Native American communities and Black American communities. A lot of these uprisings are a product of racism, but really with disinvestment and class oppression. And so to me, if if we don't put the class analysis and materialism in there, it's really hard for me to understand why anti-Asian racism matters, or like how we contextualize it in the larger, broader historical context.
So thank you, Juhwan, for that response and for starting to respond to some of the questions in the Q&A and chat boxes. I will actually, since you addressed the second part of Shannon's question, ask the first part. And this is actually maybe also coming from myself. If you could, for all the panelists, if you could talk more specifically, perhaps anecdotally, Russell, in terms of the different types of challenges that you see facing different Asian immigrants at the workplace, right? And so as mentioned by Vivian, right, we see it in terms of the Marshallese communities. But, you know, I think specifically thinking about workplace across national origin, the industries they're working in, and as, you know, Juhwan has mentioned, class. And so she offers a specific example of Filipinx health workers who are dying disproportionately of COVID at this moment. So if anybody wants to take that, we also have a number of other questions. So not everybody has to answer, but whoever feels moved.
Yeah, I guess I can. Oh, sorry. Was Juhwan going to? Were you going to speak or? Okay, sorry. I got confused just for a second. I don't necessarily have data on you know, on different ethnic groups in different professions, because I think we're still kind of collecting that data. But I think that, you know, very clearly there are differences based on profession, right? So I think that we have, for instance, certain populations, such as I think the excellent example of Filipinx health workers, and many of them are women, disproportionately kind of working in healthcare industries versus other, you know, versus other, say, East Asians, kind of in the types of roles that they are in. And so I think it's often the kind of the types of professions kind of leading that vulnerability. We also, I think another point is how people live together. So families that tend to kind of have extended families members in there. I think that's another part of that. But let me just give an anecdote from an interview I did. Again, this is with the same nurse midwife who I had spoken with. And so this is kind of a very, it's actually one of my friends. But this person, you know, when we were speaking about the situation, was saying how, you know, they are kind of healthcare workers in this context are really kind of at dealing with, you know, two bad options, right? So either they feel like they're either putting themselves at risk or they're providing, you know, poor quality care, right? And I think that sometimes when we think about these types of vulnerabilities, we kind of sometimes, because we're dealing with such huge structural issues, dealing with maybe the emotional dimensions and kind of some of these issues that go beyond the material, I think, you know, it was very easy to lose sight of that. But we can think about how, you know, people who are entering into certain fields are often doing this motivated by certain personal reasons and this desire to help back. And when you're kind of in this position where you're providing care, but then putting your own self at risk, and then feeling like you have to decide between that and kind of providing a service to people who you want to help, that can really affect like one's experience of work and add to these various types of stresses, right? This particular person also was dealing with, you know, her brother had died from COVID. And so we're kind of, and also fearing like anti-Asian racism in public spaces, right? So we're dealing with not only, you know, these particular types of vulnerabilities, but also this like job, you know, decreased satisfaction that then kind of shape all these types of mental health issues, right? And that can exacerbate things. And to give you kind of like a very clear example from, you know, one of the ways in which they had to deal with like this real kind of duel between their own personal safety versus the safety of their clients. So in this particular area for, you know, a couple of weeks, the state had made a decision where for the safety of healthcare workers, they were not going to allow partners to be in the labor and delivery room with the people who were, you know, giving birth, right? And so what happened was that this was a rule so that the healthcare workers be protected, but it was very kind of intimidating for a lot of the patients because, you know, giving birth can be a very like fraught experience. And so a lot of them ended up moving out, not necessarily moving out of state, but going out of state to places that did not have that rule. But then what that ended up happening was they, you know, disrupted, they had their care disrupted. They moved to a place where they didn't have an existing relationship with a hospital, and were kind of in like really dangerous situations, right? And so it was kind of this difficult situation in which the healthcare providers were feeling very stressed out about the fact that their clients were potentially being put at risk because of their personal safety.
Yeah, related to that, I just saw, actually, I just Googled it too to confirm. About a third of the nurses who've died in the US are Filipino. And so it's clear, Juhwan talked about racial capitalism and the intersection of race and class, that Asian Americans in particular professions are disproportionately impacted by COVID-19. And so COVID-19 is just exposing the racialized disparities in the US. Another example of racial capitalism for Juhwan that he didn't mention is that Asian businesses experienced downturns even before the shutdown. And that's because of racism. People were purposely avoiding going to Asian ethnic enclaves. And so Asian American marginalized workers in the service sector, in restaurant, nail salons, they were laid off earlier, they weren't able to access unemployment benefits, and they'll stay unemployed longer, just like what happened in the 2008 recession. So I think, yeah, I'm really concerned about the long-term impacts of, again, the intersection of racism plus this economic downturn on the Asian American service sector community. Also hotel workers. There's a lot of hotel workers who have been really adversely impacted too.
Can I jump in very quickly to tag onto that? And Russell, your comment kind of reminded me of how some of the data from 9/11 showing how Asian Americans who were who lost employment during that disaster had higher rates of PTSD afterwards, because they had a harder time accessing the same types of social networks that would allow them to kind of re-enter the job force, right? And so that had kind of these mental health issues. And I think another, as we're being intersectional, I think another aspect to thinking about, resources that Asian American businesses are trying to leverage to recover is also kind of the gender dynamics, right? And so I think a lot of this research on co-ethnics is showing how it's not only exploitations of other ethnic groups, but also gendered exploitations as well. And so I think when we can think about what types of inequalities are going to persist amidst this crisis, that's another dimension we have to think about too.
Juhwan, I didn't know if you wanted to respond to that, specifically either research-based or kind of also related to the last point Vivian made, and a question that Freddie Zhu was asking about the kind of racism erasure that it might occur between Asian ethnicities, and specifically in the workplace. And maybe that's also from the work you're seeing with the Tompkins County Immigrant Rights Coalition around restaurant workers.
Yeah, so I feel like all the other panelists have already kind of addressed this really well, so I'm just going to add on really quickly. I think with work, I feel like there's a lot of great examples. I mean, I think much of, especially in low-income immigrant communities, the work tends to be co-ethnic. So there's a lot of what you could call segregation by ethnicity, and so. But I think in terms of narrative and media, whose voices are heard and whose stories are told, I think definitely is being erased for a variety of reasons. But I was actually wanting to talk a little bit about healthcare and access to health insurance in a very important time, because Asian immigrants tend to be more likely to be either employed as not as full-time employees, or to be self-employed, which also means that they are oftentimes not eligible for healthcare at all, or very, very meager healthcare. And so in this time where healthcare is very expensive in the United States, but also very necessary, Asian immigrants, and especially the workers, are the most vulnerable in not having access to healthcare. Obviously, there's a lack of health insurance, but then also oftentimes that is combined with language proficiency, access, knowledge, and even just hour of availability and where hospitals are located. All these factor into the most vulnerable members of our community not receiving proper treatment and care that they deserve. So yeah, it's kind of related to work, but in ways that we might not expect.
So another data point related, Asians have 3 times the death rate from COVID-19 in California compared to the overall population. So I'm Mr. Stats today.
We appreciate that. Thank you, panelists. So I have a question here from Richardson, and if you don't mind, Russell, I think I'd direct this to you first. And the question is, can the panelists comment on Asian American churches during this time? Richardson's comment is that Asian American churches tend to be more evangelical, but they're caught in the middle in several aspects. And his own Chinese American church, more hesitant than other evangelical churches in reopening because of understanding the connection between COVID and China and other Asian countries. But in that sense, they're also not feeling as much urgency in addressing anti-Black racism, right? As opposed to COVID-related anti-Asian sentiment. So if I could kind of expound from that, then maybe it's talking more about the response of Asian American churches, perhaps in their reaction or response to COVID, right, as a pandemic on the one hand, and in terms of a kind of maybe racialized response, right, to COVID. I mean, again, this kind of draws off of how Asian American communities more broadly can more readily address anti-Asian sentiment versus anti-Black racism.
Yeah, that's a good question. I think, so the first part of how Asians have responded to COVID-19, in San Francisco, Chinatown, we actually have lower COVID rates because we've heard word about how dangerous it was in Asia. And so we adopted mask wearing much sooner than the rest of the American population. And we still do out of abundance of concern for our community, that we're actually more considerate and respectful of others than people who value individual rights. And so I think that's why a lot of the churches, Asian American churches, aren't meeting. They're not, because they've seen what's happened in Asia. What I've actually seen is that the racism against Asian has actually been a unifying, mobilizing moment for the Asian American churches. I've seen a movement across theological spectrums of churches coming together now to combat this racism. And I was really struck by that because I've never seen this unity before. It was only racism by Christian nationalists has actually driven Asian American churches together. And they've have lots of signatories to what's called the Asian American Christian Collaborative. And that movement, that collaborative has actually joined within Black Lives Matter movements. They've had prayer marches both in LA and in Chicago. So I think COVID-19 has been a mobilizing force for a lot of Asian American communities to come together across ethnic lines, pan-ethnically. I know a lot of the national organizations addressing anti-Asian hate aren't led by East Asians, but are actually led by South Asian women. And so I see, from my vantage point, a lot of pan-ethnic unity, a lot of mobilization on the grassroots among churches and in unions and in schools to fight the racism. And among our congressional leaders and our celebrities. So I think this actually, rather than sort of a polarizing movement, has been a real unifying moment for the Asian American movement. But then there are, of course, there's always sectors of the church and conservative parts of the community that just are different. So, but another data point: Asian Americans are the racial group most in favor of Black Lives Matter after African Americans, and I think it's because we're experiencing the racism now, and so we could again connect the dots that if we're experiencing this type of racism and being racially profiled, we could better understand how African Americans are being racially profiled and mass incarcerated. So I think this is an opportunity for us to develop empathy with those who are mass banned, who are mass detained, who are mass incarcerated, because we're experiencing the same thing. We're getting mass banned, mass profiled, seen as threats.
Okay, thank you, Russell. This question seems to be kind of circulating amongst a bunch of questions. It seems to be about a question about AAPI activism. In this moment, Kevin Zong asks in particular in terms of amongst Asian American college students, right? can you, or any one of you or all of you, address, right, the possibilities, potentials for Asian American activism in respect to the issues, not just again of COVID, but of also Black Lives Matter, and thinking, I guess, more intersectionally, right, about these issues. And a related question, Angela is asking if you think that this pandemic will have long-lasting effects on race relations for Asian Americans, or are we just going to fall back into the model minority myth, right? And finally, in a kind of related question, Nova is asking, are there specific kind of actions that you all are seeing or might suggest, right, to the audience that might be most impactful? And what platforms of our world do you see them taking place? So the political, the interpersonal, or otherwise.
I guess I can answer that. And I'll draw a little bit on my research in Japan as well, in terms of one of the tensions I have observed as far as activism in the context of disaster and in crisis is that crisis kind of facilitates the sense of urgency, right? Which can be very powerful and can really build momentum and mobilization. But, you know, for a couple of things. So first, you know, what appears to us or appears to any given person as a crisis often is not a crisis for other people in the same way, because when we think about crisis, it's kind of very tied to a kind of moment, right? But for many people, crisis is a permanent condition, right? This is a kind of, for many people who are living in the most marginalized conditions, what is happening now is not necessarily, you know, new. It may be an exacerbation of existing kind of marginalizations, but it may not necessarily be kind of a new form, right? And so, like, for instance, vulnerabilities related to, you know, with the type of work that you do and like socioeconomic status. This is not necessarily new. It's just maybe taking on a different type of form. And so I think with that, and, you know, one of the lessons that I observed after Fukushima is that the kind of narrative around, you know, emerging after a crisis, right? Involves this urgency, but sometimes the movement that comes out of this discourse of urgency makes it such that it can be really difficult to know how to collaborate and work with existing groups, right? And so, you know, oftentimes people say, okay, we need to really capitalize on this moment. We need to move forward quickly. And yes, I think we do need to, you know, act, right? But I think part of acting is also listening, and part of that is also recognizing what kind of existing networks exist or kind of have been doing the work for a long time. I think we see this very clearly with thinking about how people have talked about, you know, Black Lives Matters. Why is it that after George Floyd, this kind of discourse erupted so much, and, you know, corporations started to kind of take note and, you know, make comments, when Black Lives Matter has been, you know, has existed for many more years than that, right? And this question about, you know, like why, like about joining a movement when you haven't necessarily shown up is, I think, part of that equation as well. So I think that what that requires, right? And I think part of it is kind of this difficult work because, and in terms of negotiating vulnerabilities, and again, it's kind of related to you know, what I saw in Japan, is that there is this kind of question about there are differentials in terms of vulnerabilities, and the idea that people who are maybe less vulnerable within, like, say, a protest space, exposing themselves and at the front line so that more vulnerable people are not kind of targeted in the same way, right? So this idea that, say, if you're like a white man being at a protest and kind of being at the front lines, maybe you're less vulnerable than, you know, a Black woman, right? And so the kind of bodily risk there. But I think it's something that's very difficult for a lot of people is that, you know, also taking a step back in terms of like strategically and intellectually as well, while also exposing yourself physically, right? I think that's something that's very difficult for a lot of people to do, right? So I think, you know, to kind of summarize, what I would say is that, yes, like join a movement, get involved politically. That's really excellent. But I think that at the same time, be intentional. Like, it doesn't have to be super fast. It doesn't have to be, you know, you don't have to be an expert right away. Kind of think intentionally, build relationships, learn, read books, learn about the history of movement, because solidarity, you know, we often think about it in this very abstract way, but we have to think about the specificities around it, that these are relationships that have been built over years, sometimes over decades, right? So you can't just like enter into a space and expect that you know, you will be able to lead it, right? You have to listen. And I think that is like a key question, that we need patience, right? We need, you know, I think our project tries to do that as well in terms of like the ways we form collaborations. We're trying to listen too. We don't want to just be like the star, right? I don't think that is productive. So I think that's part of negotiating the politics.
I just wanted to quickly say that this question is funny because so last semester in the spring I TA'd for Professor Balance's class for Intro to Asian American Studies, and we had a discussion about voting and in relation to also cross-racial solidarity, and this was right as the pandemic had started in April, I think, and but it was before the real the current this year's wave of racial justice uprisings happened, and so I kind of posed as questions based on some readings, and our students were quite skeptical, to be honest, about the potential for cross-racial solidarity. In many ways, like some of the previous questions had mentioned, there were fears of anti-Asian racism coming from all people, including other people of color. And so this was kind of held up as an example as to why it cannot happen. And so that was really disheartening to me. But but since then, I've seen a lot of interest among Asian Americans of all ages and backgrounds getting involved. So I know the Letters for Black Lives had kind of re-released their letters this year. But I guess also, I think I've seen really good work done by community organizations and nonprofits in Asian American communities that have really reached out and worked with Black communities and Black leaders. And I think that is exactly the kind of work that we should be doing. And I think in addition, I think like Dr. Shaw was saying, there's many different ways of being involved in organizing, and it's easy to romanticize being on the front lines, but that is not available for everyone, and it's not accessible for everyone. But I think just even talking to your friends and starting these conversations itself can be really helpful. And I think I would also urge my younger Asian Americans on this call to think beyond just blaming your older parents and grandparents, because I think that's become a trope that is not actually that helpful. In fact, younger Asian Americans are far less likely to vote, and despite having more contact with people of other racial backgrounds. And so it is really on you to convince your friends to talk about these issues and go take action, whether that's voting or community organizing. You can't continue to blame your parents and grandparents for these issues.
You're getting old, Juhwan.
Russell, I don't know if you wanted to respond to some of that in terms of maybe activism you're seeing that's California-based, or even more maybe in other local places or nationally.
Yeah, I see a lot of activist spaces, and so let me give you my nice chart. So for Asian Americans, the issue of whether we belong, and the white-black binary makes it hard to belong because we're neither white nor black. And so, as I've been saying, on this Orientalist framework, we're now framed as outsiders and told to go back home. And so we're also feeling, oh, we're ashamed. Why aren't we more in solidarity with African Americans during Black Lives Matter? And for me, I feel like Stop AAPI Hate is that we're in partnership, that whenever we're trying to dismantle white supremacy, we may be working on one type of racialization and trying to disrupt one binary, while other groups are trying to disrupt this other binary. Just because we're not fully engaged with the other's efforts doesn't mean we're not in solidarity. We could only do so much. So like Vivian talked about, the notion of solidarity is really abstract. And so I could argue that as I work on my Asian American anti-Asian hate racism and fighting that, I'm actually supporting Black Lives Matter, because overall we're all trying to dismantle this white supremacist system. And so that you could be engaged at a whole bunch of different levels, on the individual level, on the institutional level. I really encourage those at schools to contact their presidents to make official pronouncements to denounce anti-Asian hate. Words matter, just like Congress passed a resolution to denounce anti-Asian speech. I think you need to do it on a campus level. It's a good way to organize, and I've seen a lot of schools do that. But I would just encourage people to recognize that we are in solidarity. And for those in California, affirmative action is an issue that we could act in solidarity. The issue of African American reparations, we could act in solidarity, especially since Asian Americans have received reparations over Japanese American incarceration. So there's a lot of levels in which you could act in solidarity, especially by voting. And so the idea of activism and solidarity is sort of a weird, there's no politically correct way to get engaged, I think, but we should at least be voting and getting engaged.
Can I just make a very quick comment? I think also just learning history is really useful and important. I found that I didn't watch a whole PBS Asian American series, but the introduction kind of laid out some of this history pretty well. I mean, when you look at some of the history as far as how segregation was established, educational segregation, how, the category of being non-authorized as an immigrant was established. A lot of this was in relation to the regulation of migrants from Asia, specifically China, right? And so I think that learning about that, learning how, some of these earliest court cases around segregation were in relation to, Chinese immigrants, right? I think having a kind of a better handle on some of these, this complex history and how we kind of will help us understand how we got here, and then kind of provide a more enriched way of engaging with these political issues in a way that is informed rather than just driven by a knee-jerk reaction to this crisis.
So just noting the time, I mean, there are still a couple of questions that seem a bit more specific, right, to each panelist. And so just to audience members, I'll be sure to share those with the panelists, and hopefully they can get responses to you somehow, figure out a way to share that. But I just wanted to, before Professor Chang closes out with some closing remarks, wanted to offer the space for each of our panelists to either let us know things that they're working on that maybe students, faculty, staff, community can get involved in or pay attention to, right? Especially as we're entering the final months of 2020.
So the question is, how can students get involved in research and opportunities around COVID-19? And
looks like we just lost Russell.
I know.
Oh, no, there he's back.
We may have back. Yeah, so the question, I guess, for Vivian, Juhwan, if there's specifically ways, I guess, students could be involved in terms of AAPI COVID-19 Project, Vivian, if there's anything, we should keep a lookout for. Russell, the question was related to kind of student activism, how they can get involved maybe with research or further developments in terms of Stop AAPI Hate as a project, right? Things we should look out for. And then Juhwan, in terms of, I don't know, I'm also thinking, part of the impulse for tonight's event was also thinking about students and, the Cornell community getting more actively involved, right, in local Ithaca community work. And so I don't know if you had any tips on how folks might do that moving forward.
I can just speak quickly. So, as everything is always tied to the kind of funding that you get. So, we're applying for funding and hoping that we get some, and that will kind of basically shape the ways in which we can engage with researchers. So right now, for instance, we have some researchers at my university through kind of this program in which they can get credit. But, as far as their labor practices, we always want to pay people who work for us in some way, whether that's credit or payment. So I think, we will we'll at some point kind of hopefully when we get funding, we can announce that there will be an application process, and so people can get involved in that way. I think that also just to be aware that there are many folks who are kind of studying this issue, maybe even at your own institution. And I think kind of building collaborations that way. And I think that, and I have to, again, thank Russell, because we spoke very early on when I was just developing this, and he kind of gave me a lot of insights, helped me kind of shape this, and kind of led a model for how to do this kind of research in a way that's not just extractive. And so I kind of was inspired by that, and I think that we're kind of in a really interesting moment in which a lot of people are kind of paying attention to these issues now, right? And so I think that rather than being territorial and kind of thinking, oh, these are like I have to kind of work with this particular group, just kind of look around and see what's in your local community, and maybe there may be ways in which you can get involved. And I think that I know that there are different communities of researchers, for instance, that are already kind of in conversation about what is a work that's already being done, and we're trying to kind of build those connections. So I think that those conversations are happening. Hopefully we can like connect at some point, not only research on AAPI, but also I think just on disasters and COVID in general. I think that hopefully we can take the momentum and, try to think ethically, try to think about how can we be transformative with our research rather than just kind of working towards an ivory tower goal, and really kind of like collaborate, right? And kind of use our collective resources and brain power to, really improve the world in some way. So I think that, look locally to see what's going on and, be open to collaboration.
Yeah, and Vivian's spirit of collaboration, Stop AAPI Hate has really collaborated with a lot of national organizations to do these research projects. So one thing for students who are interested in research, we are working with the National Asian Pacific American Women's Forum to do a women's report. As I said, women are harassed 2.4 times more. We're doing a white paper that gives sort of, again, connecting the dots between domestic violence, the street harassment that Asian Americans are facing, and then maybe some of the, again, the intersectional work issues that they're facing. So that white paper project will begin next spring. I want to do a white paper too on how US-China relations impacts Asians' racial position. So China bashing leads to the bashing of Asian Americans, right? And a white paper gives policymakers an understanding in shortened form of the issue and how they could address it. We have 3 other sort of research projects if you're interested. One is on mental health. And the Asian American Psychological Association is doing a national needs assessment. So Vivian, actually, you might be interested in too. They're going to survey 6,000 people, 1,000 PIs and 5,000 Asian Americans. And then we're going to then survey our response to Stop AAPI Hate. And so we're going to see, compare those who've not experienced racism, those who've experienced racism, and those who've experienced racism and reported, and see what are the impacts on their mental health during COVID-19. We're also developing a racial vulnerability index scale. So we're going to do a heat map of where racism occurs more and figure out what are the ecological, environmental factors that are the social determinants of racism. Is it increased immigration? Is it increased Trump supporters? Is it increased unemployment? So that's sort of I think it's fun. So those are the projects. Also, Stop AAPI Hate, we have a youth campaign that that's going to be funded by, it's been funded by the Jeremy Lin Foundation. He's really into this issue. And so we're going to continue to work with high schoolers and try to work with school districts to implement ethnic studies and more anti-racism curriculum. So if you want to get involved, we could use team leaders for these high school students who are actually actively engaged in implementation of policies.
That's also very much tied to what I was going to say first, which is take Asian American studies classes and broadly ethnic studies classes. I mean, I feel like for me, it was like really where my politicization came from. And so it's really been meaningful for me in undergrad and here. And so support your local ethnic studies programs, take classes, advocate for them. And I think like other panelists mentioned, like knowing the history is really critical to understanding your position in the larger context. I think at Cornell, I know there's a group organized by FGSS that works with justice for migrant families in upstate New York. And so in addition to TCIRC, which is the group that I've mentioned before, and Shannon, who's commented a few times, is quite strongly involved with. And so I don't know the capacity to which they work with students, but I know JMF with FGSS has done quite a bit of work in engaging undergraduate students in advocating for migrants who are detained and their families. And so I think there's a lot to, it's easy to think about immigration and think of just New York City and Ithaca, but there's actually a lot to do in upstate New York, not just in Ithaca, but in bigger cities like Buffalo and Rochester and Syracuse. So I think it'd be great to get involved that way. And then lastly, there are plenty of larger Asian American organizations. Before grad school, I worked for the New York Immigration Coalition in New York City. And so they advocate for statewide and nationwide immigration advocacy for policy reasons. And I think that kind of experience is really wonderful. And I guess I say this all to say that it's great to do your own research, especially if you're taking Asian American Studies classes, but also connect with existing organizations and efforts so you're not redoubling existing resources and efforts.
Great, thank you for that, Juhwan and Vivian and Russell. And just by way of sort of concluding, in the Asian American Studies program, we had a conversation about the name of this particular event, right? Hate in the time of COVID. And it's a little bit of a play on Marquez's wonderful novel, but it also has that word hate in it, right? And one of the things I feared about this event would that it would just be grim, right? And there's a lot of hard truths that we learned about today. But I think the spirit of collaboration and engaged research that Vivian and Juhwan and Russell have shared with us today and sort of encouraged us to engage in, as well as sort of the broad ranging discussion of the various sites of both discrimination and effects, but also of possibilities for action and activism and policy change, has really been sort of energizing to me. And I hope all of those folks who've joined us this evening feel the same way. So I really want to thank those people who've joined us this evening, especially those people who've contributed to the conversation and the discussion. I want to thank once again Alexis Boyce for all of the logistical work and Christine for really guiding the spirit of this event. But also finally, really people who are, as I said at the beginning, are doing the work and not just sort of contributing, but showing us the way, modeling what it's like to do kind of engaged and really important work. So thank you, Vivian, thank you, Juhwan, and thank you, Russell, for being here with us this evening. And I really appreciate it, and I'm sure everybody else does too. So thank you all, and have a good rest of your evening.
Thank you so much for having us.
Thank you.
Thank you.
Yep, thanks, Russell. Yeah, thanks, Vivian.